Hello, my name is Pam Coleman. I want to talk to you today about a little known fact in the health field. Did you know that a group of disorders known as functional gastrointestinal disorders affects 2 in 5 Americans and costs society over $30 billion annually? This was information obtained in 2009, so as our healthcare costs have continued to rise, people that suffer with functional GI disorder are probably spending even more money. This is just the cost of the medical treatments and medication. This figure does not include time lost from work or pain, suffering, and mental anguish. I recently followed a friend's journey through the healthcare system as she became ill with an undiagnosed gastrointestinal problem. The illness lasted for over 2 months as she made her way to her family physician twice, received medication, had lab drawn, and a CT scan done. At this point, she was referred to a gastroenterologist, which is a GI specialist, for further evaluation. My friend had a delay of a couple of weeks getting an appointment to get in to see the GI specialist. After taking a history and hearing her story, the GI doctor scheduled her for an EGD on an outpatient basis. The EGD was unremarkable, and the GI doctor placed my friend on some stomach medicine. My friend's symptoms continued for a little while longer, but they eventually went away, and she's continued on that medicine since that time. The only thing I would say about my friend's whole experience is that she was very fortunate to have health insurance. Her expenses ran close to $5,000, and her insurance did pay most of those expenses. The only flaw I can see in her healthcare journey was the unnecessary office visit to the GI doctor. Her information could have been faxed, and a simple conversation between physicians should have been sufficient without my friend having to wait an additional 2 weeks for an appointment, not to mention the additional specialist copay that she had to pay. Americans will continue to suffer from functional GI disorders. Many of these disorders have no structural or physical cause, and they spontaneously go away, just like my friends did. Some do not go away, but people are able to maintain a quality life on medication. As healthcare reform changes the way in which the medical profession does business, hopefully unnecessary office visits will become a thing of the past. We should be looking for ways to lessen and eliminate waste within the system. Americans place a high value on their health, as well they should. We only have one life and one body, and we all want to experience as much good health as we can. We will all have to work together to change our health care system so that it's available and affordable for each American. We need to streamline our processes so that waste is a thing of the past. Thank you for your time. Good day.